Hi guys, it's Maggie again, and today we are going to talk about clinical trials. This is something that a lot of you may have been involved in, you may not have been, but it affects everybody, literally everybody. I thought we'd talk a little bit about clinical trials and my experiences in them, and also talk about what they are, what they involved, what the patient's rights are in them, and then talk about how you can get help with them, because they can be pretty confusing. And I'll tell you in my stories how I got involved, but I'll tell you, if I didn't have the resources available to me that I did, I probably never would have been in one. So we will get into that, and I hope you enjoy this video and it inspires you to look for clinical trials. So I have been involved in probably 2 or 3 bigger studies. I know I've been involved in multiple clinical trials, but most of them were usually like blood draws or some kind of lab that I would provide, and then pretty much never do anything again with it. I would never hear about it, I never heard the results, and to be honest, I couldn't even tell you the name of what they were doing. But the larger clinical trials I was a part of were directly related to my hospital. So people from my hospital would be the ones doing the study, running the study. So I had a way of getting involved, and I had contacts and all of that. The first one that I was involved in was something called Healthy Vibrations. If you want to look it up, you can, but it was for Crohn's disease kids, and it was studying the bone density. And this was a interventional study. That just means that they were introducing some kind of intervention, and their intervention was a plate that you would stand on and it would vibrate. And the thought being that if a person stood on the plate that vibrated for 10 minutes every day, it would increase the bone density of, whoever it was. And I was part of that study for a really long time. I did the study for probably about a year where I stood on the plate, and actually at the end of that year I found out I had a placebo one that didn't vibrate. The way it sounded, I could have sworn it was real. I was like, me and my dad would talk about it all the time. We're like, it's real, it's not a placebo, it's definitely vibrating, and it wound up not being real. And then I got the actual vibrating plate, and I could tell the difference afterwards, but that was the nice thing. They provided me the real treatment after the placebo year. And this study was introduced to me from my hospital, and all of my appointments for the study were within the hospital. So it was very easy, and I had a much easier time than if I was just going out on my own trying to figure out what I was doing. The other one that I was a part of was not my hospital, but I believe it was a relationship between my hospital and then the adult one next door. They are not affiliated like organizationally, but I know that they work together just because pediatrics and adults, somewhere the lines are going to be blurred and they're going to need to work together. But I was a part of a study at the hospital over. That one was a little bit more confusing just because I wasn't familiar with the hospital as much, and I didn't know where to go or where to park or who to talk to. And that was a brain study. I got a functional MRI, and basically they had me play games while having my brain MRI'd. So now that I've kind of described my experiences with it, let's talk a little bit about what clinical trials actually are and why they impact you so much, even if you don't realize it. So in order for any type of treatment, whether it be medication, a procedure, something like that, to become usable by patients, for doctors to prescribe it or order it or whatever, it has to go through studies. They have to make sure that it's safe, it doesn't have, any insane risks for the patient, and it needs to be effective. There's no reason to make a treatment that has absolutely no effect on a patient. The idea is that a treatment should introduce something positive to the patient, whether it be curing a disease or at least alleviating symptoms. It has to be of some usefulness to people. There are a couple different types of studies. There's actually more than what I'm going to mention, but these are the 2 basic ones. There's interventional studies, and this just means that they are introducing some kind of medication, some kind of procedure, intervention that is changing how the patient treats themselves. So in my case with the healthy vibration study, I wasn't using a vibrating plate on my own. So they were introducing the vibrating plate to see if that made a difference in my treatment. And the reason they used the placebo one was to see if I, compared to somebody not using the placebo, made any kind of difference if theirs was more effective than my not real treatment. There are also observational studies, so like the ones looking at my dad's and my genetic material and our blood, or even the one where I was getting the brain MRI. They weren't introducing any new treatment to me. They were just observing the already there symptoms or the already there, you know, movements of my brain. I don't know. Guys, I'm not too intelligible about brain stuff. I'm pretty good with intestines though. But those are the two main types of clinical trials. And there's a few different phases that trials go through. They start off on the first phase, there's 4. I'm not going to go into incredible detail about them, but the earlier phases are the ones that focus mainly on safety, making sure that a patient isn't being exposed to something that's going to hurt them. And as they go through the phases, it gets more and more towards kind of how it's efficient, how it is working for the patient, isn't making a difference, the dosing and all of that. Kind of focusing on the more finite details of what they're eventually going to produce for medical usage. There are some things that you should know before you get involved in studies, because there's always a lot of question, there's always risk, and there's always confusion with them. And I think people are often afraid to get involved because they don't really know what it can entail. But the good thing about them is they're all reviewed by an IRB or Institutional Review Board and the FDA, not just for safety concerns of whatever intervention they're introducing, but also to make sure that the studies are functioning well, that there isn't bias where there shouldn't be, and you know, everybody involved in the study, both you and the people running it, are doing their job properly. They want everybody to be in their place doing the right thing to protect the patient. Now, even though these studies are completely reviewed, there is always a chance for side effects or risks. That's one of the first steps when you get involved in these studies. Somebody from the research team will come to you and go through all of the risks, all the side effects that might be possible with the study. They will carefully go through all of this with you so that you understand what you're signing up for. They have to be very transparent with you and very clear about what is going to happen in the study. They'll tell you everything, pretty much everything that they can about what is going to happen. Some other things that you should know that are very important to you is that you completely, 100% have the right to refuse a treatment that they are offering you. You do not have to do it. And the other part of this is you have the right to leave the study. Even if you do leave, whether you find that it's not effective for you or there's a certain side effect that you're just not okay with, the time that you spend in the study is still important to the researcher. They're still going to use it towards their research. So even if you're only spending a little bit of time in that study, you're only able to hold out for so long, don't feel bad. You are of utmost importance in this study, and your well-being is too. So don't feel bad about that. You have the right to leave. So what do clinical trials offer the patient? Obviously, they can offer new treatments beyond what we already have that could potentially cure, potentially decrease symptoms incredibly. I mean, they offer just so many opportunities for improvement in patient lives. And that's the huge motivation for why they even occur in the first place. They want to improve treatments available. The cool thing is, this offers a patient who is getting involved in the clinical trials for it the opportunity to have the newest treatment available. I mean, you are like ahead of the game, which is so cool. And more often than not, it doesn't include any cost to you. In fact, a lot of studies will reimburse you. And that's pretty cool. It's like you are making your job advocacy. You are putting yourself at the head of the line in treatment, and you're getting paid for it. But one thing to note is that for the medical community, it can be really tough recruiting patients. There is definitely some nervousness that you feel when you're looking to get involved, but the amount that you can help just by joining, just by getting a treatment, you don't even know the difference that it makes. And in my personal case, you know, I have Crohn's disease. If there were not patients who went ahead of me and tried out Remicade and Humira and Stelara and Entyvio, all of them, they wouldn't exist. So I wouldn't have them available to me if I needed them. That is why it's so fantastic when a patient joins one. And I mean, it's just the help that you are giving, you don't even realize, because patients down the road, hundreds of years from now, could be benefiting from you joining that study. Does that not blow your mind? So I know that it can be very confusing. Like I said before at the beginning of this video, I don't know if I would have been involved in clinical trials had I not been exposed to them with my hospital. And right now, I'm just kind of like, where would I even get started? What would I do? Because I'm so far removed from, you know, my children's hospital where they did all this for me, and it's kind of being put on me now. How do I get involved in clinical trials? So that is where Clara Health, a really cool company, comes in, and they strive to help patients who want to get involved in clinical trials through every single step of the way. I mean, from contacting the studies, which ones to pick, how do you get there, all of this stuff. I mean, they literally step by step will take you through it and assist you with everything and anything that they can. They smooth out the entire process for you, and they even provide guide sheets. So basically, the information that I am giving in this video, they have available on their website, so you can check it out. Of course, I will put all of the links below, but they guide you through every single step, and they provide a tool in which you can search for clinical trials, which is incredible. I tried it out and I put in Crohn's disease trials, which is so very broad, and I got a ton of listings, and you were able to filter out what you don't want in your clinical trial, so you were able to narrow it down. I mean, it's really cool. They really are there for every step of the way, and like I said, I would not know where to start. I really wouldn't. And when Clara contacted me and I went through their website, I mean, it just cleared it up. It makes me want to get involved in a study, especially since I'm off of medications, potentially looking to go back on them. It really excites me, the possibilities with them. They also provide an email address and a phone number, so if you are looking to get in contact with them, you are easily able to do so. And if you go on their website, there's also a little chat box that pops up. So if you email them at hello@clarahealth.com, or you call this phone number, because I'm not going to remember it. I'm so sorry. I can't even remember my own phone number, but I'll put it right here. I'll put it below too, but I'll put it right here. You can contact them and ask them your questions and ask them how to get involved in clinical trials. Alright guys, I hope this cleared up a little bit of the mystery revolving around research and clinical trials, and it makes you pumped to get involved in one if you are able to. And like I said, remember the effects that you could have on future people just by being involved in one. So, alright, check out clarahealth.com, and I'll see you in my next video. Bye!